In terms of the use of the standard blade with the King Vision video laryngoscope, it's important to note that the mouth opening requirement here is only 13 millimeters. So it does give a little bit of versatility in accommodating smaller mouth openings. The lack of a channel means that you are going to need to use a stylet to indirectly manipulate the tube into position. Now, three things to remember in operating the stylet. First of all, when it's installed, you want to make sure that the tip doesn't stick out the end of the tracheal tube, because that's more likely to be traumatic. It's also very important to make sure that the stylet is lubricated ahead of time to make it slide in and out very easily. Also, you don't want to form the stylet to give you the curvature. You want to do the stylet inside the tube because it may give you a little bit different curvature because of the sloppy fit. Typically a 60 to 70 degree angulation of the stylet, maybe 2 to 3 inches from the end of the tube. So fundamentally, following the base of the tongue, as we've talked about before, putting the tip of the blade into the vallecula above the epiglottis or underneath the epiglottis like a Miller style. Now you'll notice that I'm going to be actually looking in the mouth and following with the tip of the blade or the tip of the tracheal tube, follow the curvature of the blade until I reach the posterior wall of the pharynx. Then I'm going to look up at the screen and watch as the tip approaches the vocal cords. Put it right at the entrance, then advance the tube off the stylet into the trachea, remove the stylet, and then remove the blade. An alternate insertion method would be to use a more of a retromolar approach, which doesn't require as much curvature because you're cutting the corner, so to speak, rather than following the blade curvature. So again, placing the tip, visualizing the vocal cords, but now you're kind of coming in from the corner of the mouth, outside the molars, and if there is sufficient room in this patient, you can actually get a more of a straight shot, which makes it a little bit easier to deliver the tube in some cases. Both of these techniques, following the curvature of the blade, shaping the stylet accordingly, or using the retromolar approach, both have been used very successfully.